Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss about the role of vitamin D and calcium in maintaining the bone health. We all know that vitamin D is very important for the bone health. If vitamin D is not there or if it is deficient, it leads to a lot of bone problems, etc. But how exactly does vitamin D help to maintain the bone health? And also, why is vitamin D supplementation become so important when we are discussing about the bone health? So we will discuss about this in detail, and we are beginning with the topic related to functions of vitamin D. I am taking vitamin D and bone health as a separate video because it is very important to understand the role of vitamin D in maintaining the bone health, because out of 5 people, 3 are usually deficient in this vitamin D, and that leads to a lot of problems, especially when we age or women who are in menopause, etc. It leads to a lot of issues. So you all know that vitamin D has various functions. So it helps in the growth and mineralization of the bone. It helps in the regulation of the muscle calcium transport. It's not only the bone, it's also the muscle strength. We require this vitamin D and calcium. It also helps in the regulation of immune function. It helps in the maintenance of phosphorus and calcium homeostasis. It helps in the regulation of insulin secretion, controls the proliferation of the cells, and also stimulates the cell differentiation. It also helps in the mood regulation, in cancer prevention, cardiovascular health, and also in the diabetic management. So these are so many functions of vitamin D, just not the bone health. These are the various functions. But today we will concentrate on the bone health, and you will see that that already that vitamin D, this pre-vitamin D, when the sunlight falls on our skin, the ultraviolet B rays, when it falls on our skin, this the cholecalciferol, it gets converted to vitamin D, and once it enters the liver, there with the help of the hydroxylase enzymes, it gets converted into 25 hydroxy vitamin D, and in the kidney it gets converted to the active form 125 hydroxy vitamin D. So this is the one which maintains the calcium economy, 125 hydroxy vitamin D, and the 125 dihydroxy vitamin D. This is also helping in various other functions like your immunity, may it be cancer, bone health, your autoimmunity, diabetes, etc. So the vitamin D in both the forms helps to maintain the homeostasis in the body, and mainly it what it does is it tries to maintain the homeostasis of calcium in the body, because this calcium is very important mineral, and whenever there is reduced calcium levels in the body, this vitamin D, it tries to raise the level of calcium, so it increases the absorption of calcium and phosphorus from the intestine. Vitamin D is the only hormone which increases the level of both calcium and phosphorus. PTH will increase the level of calcium, but it will decrease the level of phosphorus. Then you have the calcitonin. It will reduce the level of both calcium and phosphorus. And vitamin D, it increases both calcium and phosphorus. So how it increases? It increases the absorption. How it will retain calcium? It will reduce the excretion of the calcium from the kidney, and also it will also increase the calcium by causing the resorption of the bones and releasing the calcium from the bones. So see here, this is sunshine. This is from the diet we get this vitamin D. It is converted to 25 hydroxy vitamin D in the liver, and in the kidney it gets converted to 125 hydroxy vitamin D. And this 125 hydroxy vitamin D, with the help of parathyroid, with the help of kidney, it helps in the regulation of calcium metabolism. So there is increased intestinal calcium absorption, calcium bone resorption, and also it acts on the vitamin D receptor. Vitamin D receptor are present in the nucleus. It is a fat soluble vitamin. It can enter the cell. So that again will help in the muscle strength, the immune function, the bone strength, etc. So with this mechanism, it will try to maintain the plasma calcium, reduce the excretion of calcium from the kidney, through the intestine, increase the absorption of calcium from the intestine, through the bone, increase the resorption of calcium. Thus, it will maintain the plasma calcium level. So vitamin D and calcium, they are best friends forever, and they are they work very closely to ensure the body function. So you will see that when you consume calcium rich foods, vitamin D helps your intestine to absorb this mineral effectively, and so that calcium reaches your bones and keeps them strong and healthy. Okay, calcium is a very important mineral which is required for building your bones, for your teeth, etc. So without the help of vitamin D, calcium absorption will be significantly reduced, and if that is reduced, that will cause weakened bones and increases risk of fracture, etc. So this friendship between vitamin D and calcium is very important, and that you will get it with the good nutrition, balanced nutrition, and improved lifestyle. See, when we see the vitamin D reports, it says just that if it is more than 30 nanomoles per liter, it is sufficient. But for the optimal function of your bone health, you at least require a minimum of 50 nanomoles per liter. So it becomes very important for us to understand about the supplementation and also the optimal level of vitamin D which is required for the proper functioning of the bone health. So the peak bone mass is attained in the third decade of life. Yes, it depends. Your bone mass depends on various factors: your genetics, your physical activity, your nutrition, your lifestyle, your habits. All of them will maintain your bone health. According to the research, it shows that if you are taking inadequate vitamin D over a long period of time, that can also lead to bone demineralization, because vitamin D, if it is less in your diet, etc., there is no adequate absorption of this calcium cannot fully function. So there is a reduced level of calcium, and when there is reduced level of calcium, this bone resorption, etc., takes place. So the cycle keeps on continuing and bone demineralization is going to start. This vitamin D deficiency, it leads to decreased calcium absorption and ultimately the release of calcium from the bone. That is what causes the circulating calcium levels to be maintained. So this continuous bone turnover and resorption, it weakens the architecture of the bones and it will increase the risk of fracture. Okay, so it also helps in the development of this osteomalacia and osteoporosis. So when we do a DEXA scan, we will see that between +1 to -1 would be a normal bone density. Osteopenia, that is below the average if it falls here, and osteoporosis is when it falls below this. Significantly, if it is falling below the average, then it is called as osteoporosis. So this is a healthy bone, and see, this is an osteoporotic bone, porous. The bone has lost its density, it has become very porous, so that if you just have a fall, it will break. See here, can you see how compact it is? But here you can see it is so porous, it is so hollow, so the moment there is a fall, it will break. So here you can see the normal bone. See how compact, how dense this is. Whereas see here how hollow, how shallow this bone is. And that is called as osteoporosis. It's very porous kind of a bone. So this leads to increased chances of fracture, because whenever the bone mass density is reduced, the fracture risk will increase. Okay. So vitamin D is very important in bone mineralization. And if it is less, then the chances of fractures are going to increase. Osteomalacia. What is osteomalacia? So osteomalacia is a condition wherein the bone is softened. So the bone is softened because of impaired bone mineralization. The mineralization of this bone only is not taking place. That is why this bone is very, very soft. So in adults we call this as osteomalacia. If the same thing happens in children, softened bones, we call it as rickets. Okay. So see, can you see here how soft that bone has become? It is bent. The bone which is supposed to be so strong, it is just bent here, causing the U-shaped deformity. Can you see the fraying of the bones here? And can you see the expansion of the epiphyseal end of the metaphysis? There is, because of the pressure, because of the weight, that has expanded. See here, it has bent. So that is because it is weakened. Okay, so this is osteomalacia, and because of this weakening, the gait of that person, the walking style changes. Patient will have joint pain, bone pain, muscle pain, weakness, fractures. All these are because of a demineralization. There is no proper mineralization happening because there is no vitamin D and there is no calcium. So in osteomalacia also, the osteoid, the bone what is there, it is not getting hardened. It is not getting mineralized. Why? Because there are no minerals. Okay. So that is called as osteomalacia. So in children, I have told you, see the kind of legs here, how they have bent. So that is because of the weight. They are so soft that they have just bent like this. Okay. So this is called as rickets. The child with rickets will have delayed closure of the fontanelles. They will have frontal bossing because the skull bones are so soft. They have just been protruding. There is dental hypoplasia. The teeth, there is hypoplasia of the teeth. There is pectus carinatum. You can see that here, the near the chest, it is just that is protruded. There is swelling in the wrist and in the ankle joints. The sutures are very wide. There are craniotapes. There is you can see this rosary here, Harrison sulcus, bowing of the legs. All these are the clinical features of rickets. So the major sign of osteomalacia are decreased bone density. The density what has to be there because of the minerals, that is not there. Okay, so that is why these bones are very, very low in density. They have a coarse trabecular pattern. There is loss of this cortical definition. There will be pseudo fractures and there will be deformities. So this is a normal bone. This is an osteoporotic bone. So this bone, the mineralization is all okay, but this is very, very thin and brittle because bone itself is less. The density of the bone is less. Okay, the composition, all the mineralization, etc. is okay. The density of the bone itself is less in osteoporosis. In osteomalacia, what happens? The total mass might be normal. Okay, the density might be normal, but what happens is the bone itself is weak because there is no proper mineralization. This is called as osteomalacia. So what is the difference between osteoporosis and osteomalacia? Bone strength. Both the bones are not they do not have that strength. So they are also weak. In osteoporosis also they are weak. In osteomalacia also they are softened. Mineralization. In osteoporosis, what happened? The mineralization is normal. The normal, if you see the overall mineral content is normal. Whereas in osteomalacia, there is insufficient bone mineralization. Okay. So then what happens in osteoporosis? There is bone loss. The bone is getting lost. The density of that bone is getting lost. And but what happens in osteomalacia then? There is vitamin D deficiency. There is no proper mineralization that is taking place. And when the bone density is lost, when the bone itself is getting lost, you will have a fracture. It becomes very porotic. Osteoporosis, it has become so porous that once you fall, it will just fracture. And here, because there is no proper mineralization, it will bend, it will lead to gait changes, it will cause muscle weakness, it will cause bone pain, etc. Okay, so when we do this DEXA scan, etc., we can make out that the density is less, there are fractures, etc., and accordingly we will have to treat them. Like in case of osteoporosis, we will have to give medication to slow down the bone loss, whereas in osteomalacia we will have to give vitamin D and calcium supplements and address the cause of impaired mineralization. So this is what I was telling you. In osteoporosis, you will see that the muscle, etc., will be normal, whereas in osteomalacia, muscle weakness also starts. In osteoporosis, the serum phosphate, serum alkaline phosphatase, all will be normal. But in osteomalacia, because there is a mineralization problem, there will be decreased phosphate, there is increased alkaline phosphatase. Okay. So that is why the vitamin D is very important in maintaining that bone density or the mineralization, because vitamin D and calcium, they act together. So when there is a deficiency of both, it will lead to that kind of a bone issues. It also plays important role in the muscle health, because not only the bone, for the muscle development, for the muscle performance, muscle repair, all we need vitamin D. That is why whenever there is vitamin D, patient will have muscle weakness, there is increased risk of fall, always patient complains of tiredness, exhaustion, etc. Because for majority of the muscle function, muscle handling of the calcium, the action potential, gene expression, everything, you need this vitamin D. So I've told you this 125 vitamin D, it increases the muscle mass, it increases the bone mass through various mechanisms, genetic expression, cell differentiation, chemical mediators, etc. It does this. So it is very much important in maintaining the bone and the muscle health. So whenever there is vitamin D deficiency, patient will have, their gait, its speed will be lessened. They cannot move quickly. Their grip, the muscle, when they are weak, the hand grip will be very weak. Muscle mass is less. That is called as sarcopenia. So it also leads to sarcopenia. Sarco is muscle. It also leads to osteopenia. Osteo is bone. So vitamin D deficiency can lead to sarcopenia as well as osteopenia. So vitamin D deficiency, if at all vitamin D is less, patients will have symptoms related to the musculoskeletal system. Patients will have exhaustion, fatigue, because they have no strength. The muscles are very weak. Their bones and their muscles ache. So patients have bone pains. They have aches and pains. They are so tired. They always have this muscle pain. Their muscle is weak. Their gait, their movement, their walk is altered. They are very slow. Their hand grip is weakened. Sometimes they have muscle twitches because of calcium deficiencies. They have tremors. They have spasms. Okay, so all these symptoms can be explained by this function of vitamin D. So vitamin D becomes very, very important in maintaining the muscle as well as the bone health. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.